This video will cover some general characteristics of myelodysplastic syndrome and myeloproliferative neoplasm. I'm not going to cover the exact diagnostic and morphologic criteria for these since that would just be too much to cover in these types of videos. Instead, I'm going to focus more on the epidemiology, clinical findings, and confounding diagnoses that can mimic these. This should give us a good way to remember a bunch of random factoids about MDS and MPN that are not necessarily used in everyday practice. To quickly define myelodysplastic syndrome, though, it is a disorder of the bone marrow where there is dysbiosis in at least 10% of at least one cell line, which leads to cytopenias peripherally. Blast must be less than 20%, and the marrow is typically hypercellular. These patients also tend to develop acute leukemia. Myeloproliferative neoplasms, on the other hand, are also a disorder of the bone marrow in which there is a clonal expansion of myeloid lineage cells leading to cytoses instead of cytopenias as in MDS. And we care so much about these because they have the potential to develop acute leukemia in these patients. Again, no prompt for this one since we all should just know this. Okay, now that we have a broad overview of these, let's dive in. The anchor for this video is this restaurant here. If you shorten its name, you get to MDS, right? And to remember MPN, look at this billboard here for a company named Metropolitan. Again, if you shorten the word Metropolitan, you get to MPN. Alright, now that we're anchored, let's move into specifics. Myelodysplastic syndromes are most commonly seen in older adults. This is represented by simply the age of our character here. Myelodysplastic syndromes can, however, occur in younger adults, and that tends to be associated with a secondary insult such as chemotherapy, radiation, benzene exposure, or inherited marrow conditions such as Fanconi anemia. I'm not going to represent chemotherapy or radiation. We all know that in general those are risk factors for developing neoplasms. To represent benzene, which is used in the production of organic chemicals, take a look at the make of the character's car. The name sounds a lot like benzene, right? To help us remember Fanconi anemia, take a look at the character's pet. It's a falcon. Falcon sounds like Fanconi and is going to help us remember it. As I've mentioned, in both MPN and MDS, the marrow tends to be hypercellular. As in other videos, the prompt for bone marrow is a bone broth drink because bone broth comes from the bone marrow. And since this drink is overflowing here, we're going to remember a hypercellular marrow. One interesting clinical finding is that MPN is associated with splenomegaly while MDS is not. To remember this, just notice the sign on the restaurant stating that their newest and coolest toy, the Mega Submarine, is out of stock. The word submarine will clue us into spleen since they sound alike, and the fact that these toys are mega submarines will help us remember splenomegaly. Oh, and since this sign is on the restaurant, which we know is our symbol for MDS, we're going to remember that splenomegaly is usually not seen in MDS. To remember that splenomegaly is associated with MPN, look at the mega submarine on the ad for the Metropolitan Company. Interesting, I've never seen an ad for a submarine. I'm here for it though. Alright, so now we're going to shift gears a little bit and talk about some differential diagnoses that commonly cause dysbiosis and that have to be considered before diagnosing someone with MDS or MPN. The first one is vitamin B12 and or folate deficiency. B12 is represented by this character's cobalt blue hat since the color cobalt sounds just like cobalamin, another name for B12. To represent folate, look at his improvised work folder he's got with him. It's a folder wrapped in vines. The word folder will clue us into folate since they sound alike. The vines wrapped around it will help us remember B9, another name for folate, since vines sound like the number 9. Alcohol consumption, as we know, may lead to folate deficiency. This is represented by this shameful behavior our character is doing here. Please don't do this, for real. HIV is another known diagnosis that can lead to dysbiosis. This is represented just like in other videos by this hoverboard because if you shorten the word hoverboard, you can kind of get to HIV. Lead or arsenic poisoning are also known to cause dysbiosis. To help us remember lead, just look at this huge collection of bullets back here, which, as we know, bullets contain lead in them. And to remember arsenic, let's just remember that this is not just a collection, this is an arsenal back here. Next, we have copper deficiency. Copper deficiency can also lead to dysbiosis, and we'll remember it by noticing that for some reason this character is using his car to transport all this copper wire somewhere. But to remember that this is referring to copper deficiency and not copper excess, let's simply remember that what he's doing here with this wire is not a good idea, and the wire is now all over the streets. By the time he makes it home, it'll all be gone. Zinc intoxication is known to lead to copper deficiency and can therefore also lead to dysbiosis. Zinc intoxication is represented by the ad here for zebra cakes, since zebra and zinc sound alike. And we'll remember intoxication simply by the fact that ads are promoting people to eat more of them, not less. Now, there are two medications that we're going to cover that are known to cause dysbiosis. Those are isoniazid and chloramphenicol. As in previous videos, these are represented by the character's prescription bottle that he forgot on his hood. You can see that the label says INH, which as we know is the abbreviation for isoniazid. To remember chloramphenicol, we're going to use the fact that this is a green bottle because chlorophyll is the molecule that gives plants their green color, and chlorophyll sounds like chloramphenicol.